Hello, and welcome to the County Health Rankings and Roadmaps 101 with a tour of our website. My name is Erica Burrows-Girardi, and I'm a community coach with County Health Rankings and Roadmaps. Today, I'm joined by my colleagues, Jan O'Neill and Justin Rivas. Hi, Jan, and hi, Justin.
Hi there, Erica. Good to be with you.
Hi everyone, good to be with you.
As we go through this presentation, we'll be taking turns answering your questions as well as sending out links via our chat box. County Health Rankings and Roadmaps is a program based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that this program is a result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. Today we'll cover an overview of County Health Rankings and Roadmaps, provide a live tour of our website, demonstrate how you can access additional tools and resources, and spend some time answering your questions. So please add your questions to the question box on the GoToWebinar interface. And also beneath the question box, you will find a PDF of the slides that I'm sharing today, as well as a PDF of the chat links that Justin is sharing. And they're going to be in the box that's labeled handouts. Let's start with this guiding question. How can County Health Rankings and Roadmaps help you build a culture of health in your community? The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and opportunity to make the choices that lead to healthy lifestyles, regardless of where they live. Not long ago, America viewed health as the doctor's office only, isolated from daily life. But today we know better, and research gives us a better understanding of how interconnected health is with income, education, housing, and a myriad of other factors. So we see this tremendous need to shift from the old lens of working in silos, as we're finding that only a cross-sector approach can fully address these intertwined and complex issues. So each one of us is a piece of the puzzle to building a culture of health. The hope and vision of a culture of health has to be shared. The circle of engagement needs to extend to the whole community. The truth is everyone has a stake in the health of the community, from your families to the schools that your children attend to the businesses that you patronize. In the same way, County Health Rankings and Roadmaps is made up of many components that work together with a common purpose. And that common purpose is to build a culture of health county by county. So let's talk about why this work is so important. Another way to think about a culture of health is a culture in which everyone in a community has equal opportunity to enjoy good health. In other words, health equity. Now you might be asking, how can we assure that our work is creating health for all? How can we move beyond a health equity lens to applying equity as a strategy? And what does health equity really mean within building a culture of health? Well, it means creating a sense of community where all individuals, and especially those affected by poor health outcomes, feel like they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 states, achieving health equity requires valuing everyone equally, with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So what I want to do is take a moment to break this down with some real-life examples of policies that have led to current inequities. In a few minutes, I'm going to review the rankings model with you, and you're going to notice that housing and transit is our focus areas that we have on our rankings model. Why is that relevant? Well, access to affordable housing is key to good health. Generations ago, during President Franklin Roosevelt's New Deal, the federal government started subsidizing a lot of housing, but they funded programs that allowed whites to move into new suburbs like Levittown, New York, while the options for people of color were public housing apartments in the same city centers where they already resided. Over generations, the suburban homes greatly increased in value, which created wealth for white families living there. And meanwhile, even though laws have changed, allowing people of color to have the right to buy houses in places like Levittown, many of those homes now are selling for $500,000 or more, which is out of the range for a lot of people. For a second example, we'll explore the wage gap between men and women. With a history of women being excluded in the workplace and women's jobs being differently valued than men's jobs, there's a long-standing income disparity between women and men. Now, this image that you're looking at from 2012 shows women earning just 77 cents for every dollar men earn. And as of last year, women were still only making 79 cents for every dollar men earn. This gap has a significant impact on families. So as you reflect on your work, we invite you to consider how you might be able to work with those who are most vulnerable in your community to identify what changes are needed to improve health equity. And I encourage you to check out the links that Justin is sharing to the Health Gaps Report and the Robert Wood Johnson Foundation site that has information, tools, and inspiring stories on how to truly address health inequity. So now that we've discussed why this work is important, let's review county health rankings. And as we share the various components that make up county health rankings and roadmaps today, I want you to think about which piece or pieces of the program you could really use in your work. This slide shows the thinking behind the rankings. It's our theory of change of how rankings can be a catalyst for action that improves the health of everyone in a community. Follow along with me, okay? Starting on the left, we take population-based data that is collected by others, and we utilize this data to create an easy-to-use snapshot that compares counties within states, and we release this every spring. But we produce the rankings for a reason, because they get the attention of media and can be used to start and broaden conversations about health in communities. Those conversations can then lead to broad community engagement and multi-sector partnerships that can in turn select and implement evidence-informed strategies to address community priorities and finally, in the long run, improve health outcomes. So essentially, the county health rankings aren't really just about numbers. They're really about a call to action. But we know that while simple in theory, putting this model into practice is challenging. So we provide tools to assist communities in each area, and we'll talk about those areas starting with our rankings model. So here on the left, you see our rankings model, and it's one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, and health outcomes. The rankings make it clear that good health includes many factors beyond medical care, factors like housing and education, jobs, access to healthy food, and so much more. It shows us that all of these factors impact how well and how long we live. So let me interpret this. So starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many factors, many health factors, those that you see in the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And then we measure two types of health outcomes, and you see those in the green boxes to show how healthy each county is. And those measures are length of life and quality of life. So let me just kind of translate this theoretical model into a real-life example so you see how it works. Expanding early childhood education improves academic achievement, and higher levels of education lead to higher levels of income. Higher levels of income make it easier to access healthy foods, clinical care, and quality housing, which in turn influences health outcomes. So you can see that there are multiple factors that ultimately shape how long we live and how well we live. Now in a few minutes, Jan is going to do a web tour, and she will show you more about the rankings and how to find that snapshot of your county, so that way you can use the data as a call to action and to determine what your health priority should be for your community. Now we're going to continue with our overview, and our next stop on our overview is the roadmaps to health, which we like to call the how-to of the county health rankings and roadmaps. Right now you're looking at a screenshot of our roadmaps to Health Action Center. The Action Center includes people, tools, and practical resources to guide communities as they build healthy places for all to live, learn, work, and play. Now we'd like to give you, our viewers, an opportunity to participate in the webinar. Jan and I are going to launch a poll to see how well you know the Action Center. And Jan, I'm going to leave it to you to do that.
All right, Erica, I just shared that. Hopefully everybody can see that. There are 3 choices here. Thank you for participating and playing along with us, folks. Give you another moment. And countdown from 5, 3, 2, 5, 4, 3, 2, 1. And I'm going to close it and then share results. And Erica, as you can see, and Justin, we have got 22% have used the roadmaps to Action Center, this is awesome because I've been doing these webinars for a number of years, and this is one of the higher counts that we've got, which is great on this part of our website. Yeah, and you know, the majority, this makes sense, have heard of it but haven't used it. And then thank you for your honesty, folks, on the what? Really appreciate that. That's great. So I'm going to hide the poll, and then Erica, you should be able to go back to your presentation.
Yeah. So I see that, you know, a little more than half of you have heard of the roadmaps have heard of our roadmaps to Action Center, but haven't used it. So I'm really glad to take this opportunity to tell you a little bit more about it. And what you see here is our Take Action cycle, and that's really, really important for our roadmaps to Action Center. The Take Action cycle and all of its resources provide step-by-step guidance to support you in your work. Now, communities use this cycle to kind of take action on what they're doing in their community. And again, I'm going to ask you to follow along with me because you'll see the steps in red. So starting on the top right, first you would gather information to assess needs and resources, then set priorities so you can focus on what's important, find the most effective approaches for your community to address your priorities, and then get to work on acting on what's important. And of course, evaluating throughout the cycle will help you improve your strategies to ensure what you're doing is effective. Now, you probably noticed 2 extra steps along this cycle, and that's work together and communicate, that sit outside of those other steps. And the reason why that is that we know that working together and communicating with your partners, policymakers, and your community is actually continuous, even as you are doing those other action steps. And at the heart of the Take Action cycle is people working together, because we know that solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. Now, in a moment when Jan takes us on our live web tour, you're going to actually see how you can link to tools and resources right here from our Take Action cycle. Another very helpful resource that I want to highlight is What Works for Health, which provides communities with information to help them select and implement evidence-informed policies and programs and systems changes that will improve a variety of factors we know affect health. This is also, What Works for Health is also found in our Roadmaps to Health section on our webpage, and Jan is definitely going to show you how to access What Works for Health during the live web tour. But right now, I want to launch one more poll because I want to see how familiar you are now with What Works for Health. So Jan, if you'll go ahead and launch that for us.
Yep, it's launched. Again, the 3 questions. And thank you for participating, folks. Give you another few moments here to respond. All righty then. So I'm going to count down from 5. I'll do it correctly this time. 5, 4, 3, 2, 1. And I'm going to close that poll and share it. And
Okay, so
yeah.
go ahead.
No, I was just
I was noticing that. Oh, go ahead, Jen. No, go ahead.
Well, I was just going to say that thanks again for your honesty, everybody. What is it? And this is not surprising. We found that this treasure trove of close to 400 strategies is just not known by a lot of folks. So look forward to introducing you to that. And then a quarter of you have heard of it, which is great, but haven't used it. I'm sorry. Go ahead, Erica. You go.
No, you're fine. You're fine. I'm really excited because you're going to actually take us on a tour of it, and so folks can be really introduced to what works for health. But I will say that communities often find what works for health to be particularly helpful for them when they're in that choose step that we saw on the take action cycle. But even if communities have already started implementing strategies, even if they've already started taking action, what works for health can be very helpful for them because it helps them anticipate what outcomes can be expected from the strategy that they've chosen. Jan will show you all of that when she gets on the web tour. One thing that I like to tell my communities that I coach that I really like about What Works for Health is that it's easy to use. It's a searchable menu that lets you look for evidence-informed policies and programs for whatever specific problem you're working on. And the good thing about it, it's all in one place. So you will get evidence ratings, literature summaries, and implementation resources. And like Jan said, there's nearly 400 strategies that we have included in this searchable database. So again, Jan is going to show you how to use that. So stay tuned in the next few minutes. Now I'm really excited to show you this picture because these are additional colleagues that we work with in the Action Center, and I'd like to highlight our coaches. We have 11 coaches, including Jan, Justin, and I, that work across the country who can provide consultation and link communities with resources to help you build capacity to improve health in your community. And this is at no cost to you, thanks to the support from the Robert Wood Johnson Foundation. So Roadmaps to Health Coaching offers community leaders opportunity to strengthen or rejuvenate a multi-sector partnership so that they're better poised to be able to advance the type of work that builds a culture of health. Coaches can help communities enhance capacity to be able to do their work. We can help you build direction, alignment, and commitment to implement and sustain specific strategies to enhance a health outcome for your community. And something I really like to do, we can connect you with other community leaders or national experts who are addressing similar challenges or maybe even taking advantage of similar opportunities to build a culture of health. So you can connect with a community coach by clicking on the Get Help button located throughout our website, and we coaches respond within 48 business hours, so we're very accessible. Now, before Jan begins the web tour, I do want to highlight some key takeaways. So far, we've discussed why this work is important. We've reviewed the rankings model that shows what we use to determine the county health rankings and what influences health in our community. We've also touched on roadmaps to health, which is the how-to of county health rankings and roadmaps. So let me just take a second to kind of tie all this together, the what, the why, and the how of county health rankings and roadmaps. First, it takes everyone, all of us working together to improve the health of a community. We need to move as quickly as possible from data to action. Folks, please don't get stuck in analysis paralysis or drowning in the data. We encourage communities to look to the evidence to inform their actions, and sometimes innovation is, you have to innovate. Sometimes because of what's happening in your community, you just have to try something new. But if you do innovate, be sure to evaluate your actions. keep focused across the health factors. We know that there are basically 4 major health factors that influence our overall health, but those social and economic factors really have a large influence over our overall health. So, don't forget about those. And prioritize your efforts to focus on creating better opportunities for health for everyone in your community, especially those who are not as healthy as others. And lastly, don't ever be afraid to take on policy, systems, and environmental changes, because these are the types of changes that in the long run will create the more sustainable changes for health and opportunities for health for children and adults in your community. So having walked through the overview of the County Health Rankings and Roadmaps, we are now ready for our tour that I promised you that Jan was going to do for you. So at this point, I am going to turn everything over to Jan, and she will actually take you on that tour. I'm going to share my screen with her.
All righty. Thank you very much, Erica. And you should see my screen of the website.
I do.
Excellent. All righty. Well, I'm going to take everybody on a road trip here, and we're going to begin with our countyhealthrankings.org homepage. I'll give you some tips on how to navigate around our site and where to find different tools and resources. And then at the end, I'll walk you through a little bit about how a community might use these tools and resources to support improvement efforts. So let's start with the orange navigation bar here at the top of the page. This bar stays at the top throughout the site, and if you ever get lost, it's a great way to navigate around the full site with just a few clicks. And no matter where you are on the site, you can always scroll up and just click on the County Health Rankings and Roadmaps logo to get back to our homepage here. Under the Rankings tab, you'll find information about our approach, rankings methods, and measuring progress, as well as tools to help you understand and use your data. And then next to that, on the Roadmaps to Health tab, you can access our Action Center that Erica mentioned and What Works for Health, she also talked about, and also view stories of communities taking action. You can also learn more about our community coaching if you could use some guidance or a thought partner as you work to improve health in your community. Under the Resources tab, you'll find reports, which includes your State Health Gaps Report and the Key Findings Reports from the past 3 years, so key findings for the entire country and trends and so forth there. You can also find our upcoming and archived webinars, and you can find FAQs, frequently asked questions. And under the More tab, the menu there, you'll find the link to our county by county blog and the About page where you'll find information about our program and publications, some of the background behind our model. You'll also see over here the RWJF Culture of Health Prize, and here if you click on that you'll see information about past prize winners, including their stories and videos, and you can also learn more about how you can apply for the prize this year. There's the deadlines coming up November 3rd, so take a look at that. And in the middle of the page, of course, you'll see the map of the U.S. and there is a search bar here. And you can search for your county or your state there, or you can also search in the main search bar at the top up here. So what I'm going to do now at this point is to explore the rankings. I'm going to click on the map and we're going to go to Kentucky because I picked it for this webinar because it's the home of this year's RWJF prize winner, Louisville. And you'll see, and every state has the same looking page. You have the same data points and so forth. So in Kentucky, Erica mentioned health outcomes. Here's a map of health outcomes in green, and you also see Kentucky's health rankings in blue over here. As you scroll down the page, you see the state health gaps reports, and you could click on that and read the report for your own state. You could download that. And if you keep scrolling down, what you'll also see is where you can download more data. You can even find more data resources. There's quite a lot of data. It happens to be in Kentucky at the sub-county and demographic levels. So you may want to take a look at your own state to see what you have. You can also scroll down further and see the other community health improvement resources available, and you can click on that to see who else is working on health in your state. And you can also see if there are any community stories that would be interesting to take a look at to see how a community is moving from data to action. In this case, it's a story about Kentucky youth advocates. Also on this page is the state lead who we work with throughout the year to make sure that funding awards get out, webinar information, and other updates and so forth, as well as coaching opportunities. So this is a very rich page here. So I'm going to scroll back to the top, and from our state page, we can either select the county from the drop-down menu here, or we could click on the county on the map. So I'm actually going to click on Jefferson here. And when you click on the county, it'll take you to the county snapshot. And across the top of the snapshot, you'll see a number of tabs. And these tabs offer a few ways to explore your data. You can use them to explore individual measures, get to downloads for your state, and you can use them even to compare multiple counties. And a new feature in 2016 is the ability to compare counties across state lines. So I teed that up for you all so you could see what that would look like. This is a new tab, and I have entered in Kentucky, and I'm interested in comparing Allen and Jefferson, but I'm also interested in a southern county in Indiana, which is bordering Jefferson, and that's Clark. So I've pulled up all of those, and that is another feature new this year. So I'm going back to the county snapshot here, and back in the snapshot, before we dive into the data, we first want to understand what the data is measuring. So in the first column, you'll see we use 35 measures just for the rankings, just 35 measures, because again, remember, it's just as a call to action. It's not a deep dive. So you'll see the 35 measures we use to calculate the county rank, and if you want to learn more about each of the measures, you can click on this Measures tab, or you can go directly to the measure from the snapshot. So what I'm going to do for this webinar is I'm going to scroll down to obesity and click on that tab. And when I click on that tab, what I'm getting here is I can see a map of adult obesity for the entire state. I can also see, if I'd like, I can go in and see the data county by county. I could see a description of what this data is about and why we include it. I can see where the data came from. And I can also see what strategies from What Works for Health have been shown to be effective to address obesity. And to the left, you see a summary of the measure and a little bit about the rankings methodology and a summary of everything, sort of a top-level view of that measure. So in this case, you can see for this ranked measure, we have 1 year of data, 2012. So now that we've gone into one of the measures a little bit more deeply, let's go back to the snapshot of Jefferson County. So for most counties, we provide county level data, and you'll see that in the second column here. There's a few things you can do to better understand your county's data. First, you can hover over the measure, so you can see what that measure is all about. And in this case, premature death is years of potential life lost before the age of 75, and it's a rate. It's per 100,000 in the population, age adjusted. You can also compare to the state number. Are you doing better? Are you doing worse? Are you doing about the same? And if you're doing well, and in the case of Jefferson County, the rate is below the state, so they're doing better than the state, you may want to look at the top U.S. performers, which is the top 10th percent in the entire 10th percentile in the entire country. It's more of an aspirational number. And for some of our measures, we have enough data to look at a trend. And if we have that, we'll give you a trend graph. So if your county is getting worse, you'll see a red. If it's staying the same, you'll see yellow. And if it's getting better, you'll see green. So let's take a look. I'm going to scroll down to children in poverty, which is in social and economic factors. And you can see the trend there is red, so it's getting worse. And when I pop it open, what I see there is Jefferson County is in blue. So it's higher than the U.S. as a whole, but better than Kentucky, which is in green. The conclusion, if you look at all the data points, which is what our statisticians do, Jefferson County is getting worse for this measure, at least for the years of data that we have up to 2014. So I'm going to click out of that. So once you've explored and compared your data, you might have a good sense of what's going well and what areas need more work. But if you still want a little more guidance, you may want to go up here and take a look at areas to explore. And so when you do that, you'll see orange will flag those areas that you may want to take a deeper look at. We've also added areas of strength, which is as important to take a look at. What are the strengths that you can build on? And so those will pop up in purple. The county snapshot is very rich with data. This shows you the ranked measures, but we also have embedded in here additional measures that we don't include in the rankings. So if you click on any of these plus signs, you'll see those additional measures for at the county level. And this year, we in 2016 added 6 new additional non-ranked measures, including drug overdose deaths, insufficient sleep, and residential segregation. And we actually have a webinar about that, which you can find in the archived webinars.
Hey Jan, this is Justin chiming in. So I do have a few questions kind of rolling in as we're discussing data here, and I might challenge you here and fire off a double-barreled question. So first, how could we kind of like look deeper, dig deeper into the data we have? And then there's quite a few questions that are coming in regarding the sources. Basically, where do we get our data and how do we source it?
Great questions. This is perfect timing because actually in this part of the web tour, I'd like to take you to a place where you can go beyond the snapshot data. So perfect timing for that. I'm going to pop back up into health rankings, and first let's address the data sources issue. If you click on rankings methods, you'll see a wealth of information about how we rank and what we rank. And if you click on data sources and measures, you can actually see the list of measures on which the rankings are based. You can also see a list of additional measures and a summary of changes and so forth. So there's an awful lot on this page here. Going back to this tab again, let's take a look at using the rankings data because this can help you do a little deeper data dig. Part of diving deeper is to gain a better understanding of who in your county is most affected and the factors that contribute to poor health. So for example, who's using tobacco, or who isn't succeeding in your education system, who's unable to access safe and affordable housing. So to help you with those questions, we've included these tools on our site, and it can help you get more out of your rankings data, and also how you can measure your community's progress over time beyond the rankings data. So looking at using the rankings data, there's actually 7 sections, and it includes a section on digging deeper. And in digging deeper, that helps you think through what other information you can find to further understand health differences between subgroups. Another section, finding more data, down here, actually directs you to additional national and state data sources. So there's an awful lot in that using the rankings data tab that I think will be helpful to people that want to go beyond the rankings data or get more out of their snapshot. Also in this tab is this measuring progress piece, and that I encourage you to take a look at that. You can look at that to think about what other data can help you tell your community's story, and there's a neat little self-assessment tool there that can help you see what are the areas of capacity building in your community that might need a little more shoring up. What are you already doing well? So thanks for those questions. So I'm going to take us now into the roadmaps to Health and Action Center, because now that we've explored the data, we're ready to take action based on that data. We're ready to move. And we use that roadmaps menu at the top to get to the Action Center. I'm going to scroll down so that you can see the Take Action cycle. And Erica, let me just check with you. Is that easy to see?
That looks really good, Jan. See if you can get a little bit smaller so we can communicate.
All righty, there you go.
Yeah.
All right, very good. So here we are in the Take Action cycle, and the guides, there are actual guides for each of these steps, and when you scroll over the guide or the step, you can see what's included there. So you don't have to actually click on the guide or the step to go in and see what it has. You can see first what you're looking for here. And you'll also see the guides are available on the left-hand side, so you can get to them that way too. There's, I'm going to take us into the Work Together guide so that you can get a little deeper look at that. So you can see there's a description, there's a purpose, who to involve, and in Work Together there are 9 key activities, and these can be guidance for you to figure out, you know, which of these things are really our challenges right now. And I want to point out that we added this new key activity, Work Together to Address Health Inequities. You may want to check that out because it has specific guidance on addressing health inequities in your community and some tools. I'm going to take us into the Recruit stakeholders because this is such an ongoing challenge. And you can see the guidance is on the left, and each activity will have these 5 suggested tools. These are sort of coach's pick, if you will. If there are more tools, you could click on the View All Tools, and it'll actually broaden that look. So you can see there's a good deal more tools here. But here's our coach's pick, if you will, the top 5. You can also see throughout our site sometimes communities in action. In this case, this is United Way of Greater Toledo. We showcase how they're using 3 of the tools that we feature in this key activity. So take a look for those communities in action to see how communities are moving from data to action. They focus on the nuts and bolts of how work is done, their key partners and their accomplishments, as well as how to get in touch with them. So again, I'm going to point to Get Help. That's something that Erica mentioned. That's how you can get to us. These Get Help buttons are throughout the site. And And that's a way to talk to a coach at any time within 48 hours. We'll get back to you by email or call. What I'd like to do is show you another way that you can get to tools, and you can click on this resources tab and go right into tools and resources if you want, if you know you have like sort of a theme that you're looking for, you know what you're looking for. And let's say we are interested in looking for tools for addressing inequity or building equity in our community. And so you can see there's quite a few tools here, and I am just going to take you to this one tool, and I've actually popped it up already. It's the Equity and Empowerment Lens 5 Ps worksheet. It's one of our favorite tools. And here's what it would look like when I clicked on that. It gives you a description of where it's from, and I can actually click on the tool and download it to my computer, and then away we go. So you'll find that this is sort of a one-stop shop right here for tools and resources. So that's our Action Center. You'll also find actually what works for health is in the choose step, but I am going to now, the third part of this tour is to take you directly into what works for health right here from the orange navigation bar. So again, I'm going to go up to the Roadmaps tab. I'm going to drop down to what works for health, and this is the all of the policies and programs and strategies that have been vetted for their effectiveness, and we rate all of those. And so when you go into what works for health, you can learn about the strategies that can work in your community. You can see over here our new or updated policies and programs. They will always be listed. These are always refreshed. You can learn more about the ratings themselves to see how we define those. And you can also see how a strategy is rated specifically. What I'd like to do is, this is just show you how a community might use this tool. So imagine that we're a community partnership that's focused on childhood obesity, and we are working with educators and parents and some nonprofits who are specializing in healthy foods, along with public health and healthcare practitioners. And our goal is to provide healthier food options for the kids. So what I'm going to do is I'm going to start, and I could get there by putting in the keyword search here, but I'm going to go to our model for the purpose of this demo. And I'm going to click on diet and exercise because I'm interested in what kinds of approaches are being offered there. Now you can see there's over 73 results. That's quite a bit. But our goal is to provide healthier food options for kids. So I'm going to scroll down and take a look at the approaches, because strategies have been grouped, and that sort of is in alignment with the goals. So our goal is to increase healthy food options. It looks like there's 26 strategies. I'm going to click on that and see what pops up here. Now we see that when we click on that, there's 26 strategies that pop up, and that's quite a bit. So we thought, well, we're talking to each other. We say, we don't have a lot of money for evaluation. Why don't we look at scientifically supported strategies first and just see if there's any there that we could maybe adopt in our community. Two pop up when I click on that filter: school breakfast programs and school fruit and vegetable gardens. Both are scientifically supported. Again, we have a conversation. We already have school breakfast programs. They're working pretty well. We decide, let's take a look at the school fruit and vegetable gardens and just see if that might fit. So here you can see there's a thermometer, and this is going to be on every strategy, and it'll show you the evidence rating, and actually all the evidence ratings, and this one is scientifically supported. So these are the ones most likely to make a difference. When you scroll down, you'll see what the expected beneficial outcomes are. Those are the ones that the strategy is directly intending to achieve. But we know that strategies have other impacts as well. So we also will list those when there's evidence that shows that other areas are positively impacted. And if you continue to scroll down, you'll see the evidence of effectiveness here. We'll see whether there might likely be an impact on disparities. In this case, we haven't found that to be the case. Implementation examples that you can go look at directly, and even some resources for implementing gardens. So let's say we have keep talking as a community and we say, you know, that's kind of interesting, but we'd be interested in seeing if maybe there's some other policies or programs that we might want to take a look at. And that's where we would come down here to look at the related policies and programs. It's a good place to check in case this particular strategy you've just looked at isn't just quite a good fit for your community. I'm going to scroll back up. And the last thing I want to show you is this community in action. Again, these are scattered throughout our website, and this one illustrates how at Larson Elementary School in Central Michigan, they implemented a school community garden. And so you can learn more about how they did that, and you can even contact them to find out more. So that's the end of the web tour, and at this point, I'm going to see if there's any questions, Justin, and I'm going to, before I get off the web tour, I think I'll just see if there's anything else people want to see from the website. Erica, have you seen any questions?
I did not. There were a few that we were able to answer while you were doing the tour, but I think we're good for right now.
Well,
thank you so much, Jan.
You bet, and I'm going to make you the presenter again.
Thank you, and are you able to see my screen?
Yep, we sure can.
Great. Awesome. I do want to encourage you to ask any questions that you have using the question box. Justin will be responding, or at least letting us know what questions are coming at the end so we can respond to your questions. And Jan took us on a tour of Jefferson County. She showed us their county snapshot, and the city of Louisville was one of our RWJF Culture of Health Prize communities. So let me tell you a little bit about the prize. The RWJF Culture of Health Prize recognizes communities like Louisville that have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing greatest challenges, with the opportunity to live well. And the 6 criteria you see displayed on this slide drive the selection of prize winners. And we're always looking for communities who are able to bring these criteria to life. I do want to remind my colleagues to mute themselves so that way our listeners can have the best listening experience. Now here on this slide, you see the winners of our RWJF Culture of Health Prize, and those in orange, those orange teardrops represent our newest winners. Those were announced last month, and those in the blue teardrops represent past winners from our prize communities. As you reflect on everything you have learned today, and as you move forward in your own community health improvement journey, working to create health for all, we invite you to focus on the 5 Ds. So first of all, investigate the differences. Use digging deeper and other data tools that Jan was showing you to understand the differences between groups of people in your community. Focus on the drivers that most influence health. Policies, systems, and environmental conditions that create opportunities to improve health for all. Jan, I think you might need to mute yourself. I'm still hearing some background noise from you guys. Dig into root causes. While all of the health factors, we know there are a myriad of health factors that affect health outcomes, and we talked to you about 4 today. Be sure to focus on those social and economic factors that contribute to the most to poor health outcomes. Determine most effective strategies, especially those strategies that, if directed to those greatest in need, would reduce health disparities. And finally, do it. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. So with that, I am actually going to turn it over to Justin to see if we have some questions that have come out. And I know he's been monitoring those.
Yeah, thank you, Erica. So yeah, we've had a few really good questions roll in. So I'm going to fire off right away here. And the first question's just regarding coaching. So someone mentioned that they have a community that they think might be ready for coaching, and they're just more curious about how the process starts and what's involved.
Okay. So coaching is one of the really neat nuggets of resources that we have in our Action Center. And if you are interested in coaching, my first suggestion would be to go to that peach Get Help button on our website and click on that. We'll ask for just some general information, like, where you're located, and of course, obviously some contact information, so we'll get back in touch with you. We will reach out to you within 48 business hours, and the process goes from there. We're usually able to, in most cases, be able to help people on that very first phone call or that very first email. And then in some cases, there will be communities that want extended help, and that's fine. We actually have the resources to provide communities with a coach that can work alongside a partnership for up to 12 months to help them move forward with their health improvement activities. So again, maybe a phone call or two, but you also have access to us for up to 12 months depending on what you may need in your community. But you start by using that Get Help button. And I do want to emphasize again that coaching is a resource that does not cost communities anything due to the contributions of the Robert Wood Johnson Foundation. Thank you so much for that question. Justin, are there any others?
Yeah. Thank you for that great response, Erica. So we had actually a few questions and some interest regarding specifically rural communities, and I guess I get to summarize the few questions. It would just be what can be done about rural communities or rural health, and is there anything that we offer specifically that could be tailored towards those communities?
Okay. Janet, feel free to jump in. I will just very quickly start by saying that believe it or not, the majority of the counties that we have in the United States are actually rural counties. So rural health is important. So we have actually produced a report, and you'll find this in our report section on our website, that's called What Works? Strategies to Improve Rural Health for that reason. And so I would start with that. Jan, what would you add to that?
Yeah, I think that is a really good place to start. You could also, again, go into the tools and resources and search for rural and rural health, and you'll see some good tools and examples that way. I'd also say contact us through Get Help. A number of us, as Erica said, are working with rural counties specifically, and we also have some webinars about this work. Rural communities have some specific challenges. Obviously, they suffer the worst health, are struggling with the worst health, just generally speaking, in our country. At the same time, they also enjoy some wonderful resources like the kinds of relationships and collaborations that they have, and we have some great examples of that in our stories and in our prize-winning communities. So definitely contact us for follow-up on that. We'd love to talk to you further about that.
Anything else coming out of there, Justin?
Yeah, I'm just taking a look here. I think this is a good question, actually, because it maybe speaks to some communities that we would like to do more outreach in, but what could be done if someone has specific interest in working with American Indian populations or tribal communities? Is there a way to maybe search that on our website?
Jan, do you want to start, and then I'll finish up?
Yeah, I actually got back to this person in private chat also, and this was somebody in Virginia. So one of the things I would say is to go in and take a look at the Virginia additional data sources. When I did that, there are a lot of additional resources in Virginia, and one of them includes the Virginia Atlas of Community Health, so that would have a breakdown more demographically. There's just quite a few demographic breakdowns here. Let's see, you know, yeah, there's a number of different measures and data sources there that could be looked at. So that would be one source that I would go to. If you want additional sources or if you want additional help, again, I'd say press that Get Help button and get in touch with us, and we can do a deeper dive into that
Right.
with you. And the other thing I want to mention is we do have 3 tribal nations that have won the Culture of Health Prize, and they are part of the resource here of joining our family, our County Health Rankings and Roadmaps family. So please, by all means, let us know. Take a look at those prize-winning communities and see if there's some things there that might be of interest to you. And we could certainly reach out to them and see if we can get some more answers for you. Anything
Yeah,
else?
I would just remind our audience that one of the things that coaches love to do is to be able to connect folks with other communities, and so we would be more than happy to do that. Jan, I was going to tell them about the our Culture of Health prize winner, so I'm glad that you brought that up. I think we're just about out of time. I want to wrap this up. Are there any other really pressing questions, Justin? If not, we are going to wrap this up so we can keep everybody on time.
I think we've covered a good amount, Erica, and I think whatever we didn't, we can definitely get to right away once we get offline as well.
I want to thank everybody for your questions. They were actually excellent questions. I appreciate your participation in today's webinar. Jan mentioned a series of webinars that we have, and we do. We have so many that we have archived on our website, and we have some that are coming up throughout the year. So I want to make sure that you know how to register for those. You can actually go to this address to register for upcoming webinars, and you can also check out our archived webinars. Please do that because we have lots of good information for you. We also have a presence on social media. You can follow us or communicate with us or to share information that, pass along information that we're sharing via Twitter and Facebook. I also encourage you to subscribe to our e-newsletter to get information about our webinars, new reports that we generate, all kinds of information that can help you as you move forward with your community health improvement work in your county. And as we close today, we invite you to kind of ponder these questions. Who else do you need to share this information with? And as you think of who that colleague or person might be, do share our website with them. Our website address, countyhealthrankings.org. And don't forget about all the tools and resources that are in our Action Center in addition to the rankings. That last question is, what is one idea for action that you're taking from this webinar? And I want you to take that idea and I want you to commit to seeing it come to a reality. And don't forget that there are 11 community coaches available to help you as you move forward with your work. So again, I want to thank you for taking an hour of your time today to join Justin and Jan and I, and we appreciate your participation. Justin and Jan, I thank you for your help with today's webinar, and we hope to see everyone on future webinars. Thank you very much, and have a good afternoon.
Thank you, Erica. Bye-bye.
Thanks, everyone.